Assalamu alaikum. My name is Naseem and welcome to my channel, The Cool Principal. So, my dear students, be with me for the upcoming new videos and don't forget to like and subscribe my channel. So, today we are going to learn how to do the catheterization for the female patient. The aim to do the catheterization is to remove from retention and we insert before the surgery and to take the urine specimen. So let's look at the equipment. We need a receiver, xylocaine gel, distilled water, 10 cc syringe, sponge holder, urinary bag, and the urinary catheter. We need unsterilized gloves and sterilized gloves.
Let's start the procedure. Always greet the client, ask permission and provide privacy. Okay, so once you will get the permission from the patient, then you will check the orders, read it again and check carefully. This is the same patient. For the patient safety goal, that the right patient, okay, and the orders are here and the MR number of the patient, then only you are allowed to go for the procedure. So I have checked this is the right patient and now we are going to start our procedure. Okay, so you have to place the Macintosh under the patient buttocks, which I have already placed it. Okay, and before going to the catheterization, you will prepare your swab first. So I have prepared the normal saline swab. I am going to clean. You can clean until it will show this is properly clean, and then clean the mid side too. Then discard the cotton. Okay, now our area is ready. Then you have to assess for the meatus. You can see the meatus, you can clearly see the meatus is here under my finger. Okay, so I have checked. Now I will prepare the equipment. So before touching to the sterilized equipment, you have to take out your gloves. Okay, take out without touching to the outer surface, discard it, and then you will wear the sterilized gloves by washing your hands again and use aseptic techniques. So I am going to attach the urinary bag. So I have the nice place here to attach it. So if you are going to attach with the bed, then you can take a piece of the bandage and then you can tie with the bed. Okay, so now it's tied with the bed and now we are ready to go for our sterilized procedure. Now I'll wash my hands with the 8 steps and I'll wear the gloves again and then I'll start my procedure. Now I have a sterilized catheter with the size of 16 in my hand. I will tear the upper side. Okay, now I will tear it. So I have torn the upper side. Now this area is clear. Now I will take someone assistant to put xylocaine gel on my hand because this is unsterile, so I don't want to touch with the xylocaine. Xylocaine gel is here. I will lubricate 2 to 3 inches of the catheter with my sterilized gloves. So now my catheter is ready to insert. By opening with the finger and the thumb, I will insert the catheter into the meatus and I will insert around 2 to 3 inches or until the urine will come into the catheter. Okay, my 2 to 3 inches are inside. I have passed the catheter. Now I will attach the bag here by removing the cap. So I have removed the cap. Now I have attached the urinary bag here. Okay, so now our catheter and the bag is attached. Now the urine will be flow into the bag. Now my next step is I'll remove my gloves. I will fill the syringe of the distal water of 10 ml. So I am going to fill the balloon by inserting the 10 ml. Okay. So once I will insert the 10 ml of the water and I have made the balloon inside. Now I will check it's fixed. Okay, this is properly fixed. It's not coming out. So our catheter is ready. Now the urine is going down and then I will secure it and then I will give the sport to the patient. I'll make it on the upper way so the patient will not feel uncomfortable. I will give the trouser to the patient and at the end I'll make the client comfortable.